to WRPB and WRPB Studios. Okay, so I have learned over the years doing this that pills are not the answer. Surgery is sometimes not the answer. There are other things that you could try before you get to that point. And it's ironic because when I was like 17 or 18, I had a car accident and I went to a chiropractor one time and I left there in more pain. I swore off chiropractors for 50 years. And about, I don't know, a couple months ago, I had some pain in my shoulder and I have a good friend who's a chiropractor now, and I went to her and I found out that she was the only one that was able to solve the problem because the ibuprofen and that stuff that lasts a couple minutes. It's not it's not a cure all. It's not a fix. With me is Dr. Khalil. Did I get that right?
Thank you.
Okay. And you are an acupuncturist?
Yes,
Did I get that right?
yes.
Okay. Why?
So I decided to become an acupuncture doctor back when I was only 21 years old because of the fact that I just saw how people were so sick. I wanted to do pharmacy, but then I decided against it because there was just too many medications being prescribed.
You never know. It's a gazillion. Every other commercial is about a pill.
Right, right. And now, I always was into health and fitness as a young child, and I wanted a better way to serve my patients and be able to treat them holistically and get to the root cause.
So, is acupuncture is its own niche in the medical field, correct?
hmm
Why did you pick that?
Well, because I just thought that, when I learned about acupuncture and I wanted to get to the root cause of the disorder, and it's a very old Chinese medicine. So they've been doing it for thousands of years and it has to work. So when you do that, and then you also have the herbal medicine to help with the pain and help with inflammation, help get to the root cause of disorders, you're able to help patients, and that way they get better and they stay better.
See, now, a lot of people don't understand, I think, that our bodies are meant to heal themselves. Sometimes we
hmm
need a kickstart,
Exactly.
okay? And surgery should always be your last option.
Right.
Always be your last option. So, there are so many things out there, and there's a division, I guess, between Western medicine and Eastern
hmm
medicine.
Yeah.
So, what's your which?
So, as you know, I'm also an RN. I've been
Okay,
in the hospitals for 5 years
right,
through, different types of viruses. And, when I saw what it's like in the hospitals, it's horrendous because all we are able to give the patients are drugs. And if they
right.
have a pain, we give them morphine, Percocet. They just keep asking for it over and over again. It doesn't solve any issues. So, with acupuncture, I decided to get back into my practice and open up here in Port St. Lucie due to that, because people need to understand that there's other ways.
So, is acupuncture, for lack of a better word, a cure, like a fix the problem, or is acupuncture is you have a shoulder problem, you're gonna have to come in for the rest of your life?
So, acupuncture is very similar to therapy. If you were to injure something, you need a therapist or some acupuncture to help it to heal.
Right.
So, we can help heal the body.
Okay.
If you've had something for your whole life and it's been 20 years, you've had lower back pain, and now you're 80 years old, this is a great modality to help prevent you taking pain medication. So, it's something that you would do and have it just stay every week or 2 weeks, and that way you continue to stop the medication.
Okay. So, when you say that, will it get to a point that you won't need medication at all?
Oh, yeah, definitely. I've
Okay.
seen patients completely stop their medication.
Will it get to a point where you won't need acupuncture?
Yes, if they're young enough to heal, then they could stop for sure. I've seen it happen all the time.
So, let's just go with someone has a shoulder pain,
hmm
and they come to you, and you do acupuncture with them. How I'm thinking that as a doctor, the key is to, for lack of a better word, get rid of them.
hmm
Okay, you don't want them for the rest of their lives.
Yeah,
You want them to heal.
right.
How long do you think most people stay on a treatment?
Well, I always tell people give it at least 10 sessions,
Okay,
and that way you can see where you're at because your body has to heal itself. So when you're putting the needles in the body, you're allowing that blood flow to arrive to the location,
okay,
and it moves energy and it moves blood. And it also causes a healing reaction because sometimes in injuries, our blood flow stops going there. So it starts to get dry and hard. So when you add the needle there, the blood moves and there's healing. You send a signal to the body to arrive to that location. So then after a few sessions, the patient starts to feel better.
And my viewers know me for years, and I'm a big believer in the body is energy.
Hmm.
Okay, so I get that. And we were talking in the green room, and the the needles are like how thick?
They're 36 gauge usually. That's what we use.
Which is how thick for ignorant people
A
like
little
me.
bit, a little bit thicker than my hair. Just one strand. It's very thin.
Okay, and when I talk to people, they say, "Yeah, it was nothing with nothing." I
Yeah,
went,
yeah.
and we're also talking about how long the session is.
The session is about 1 hour, but the needles would be in the body between 20 to 30 minutes.
Okay, so when you say why, what's the time difference? The extra 40 minutes or
It depends on the patient because if a patient's much older and they need more circulation, I'll leave them a little longer.
okay. How long does it take to, like, for lack of a better word, set them up with the needles? And how many needles does most people take?
Typically, the needles are between 20 to 50, depending on the patient.
Wow,
Yeah,
okay.
so I can do their whole back if their whole back is in spasm.
Right.
I also treat holistically people for any types of disorders. So don't just do pain. We can also do irregular menstruation. We do depression,
I don't have those.
anxiety. We do we do things like menopause, hot
I don't have that
flashes.
either.
So
I don't have the hot flashes either.
so we treat patients holistically. So when we do treat them for pain,
Hmm.
they actually get a lot of good side effects, which is better sleep, better mood, less anxiety. They have more energy. And in the office, I do also offer, injections of vitamins and glutathione, which helps decrease blood pressure. We do also homeopathic injections. Instead of going to a doctor and getting a steroid, you can come to me and get natural, basically, injections that will help with inflammation.
Okay, so I'm a case and a half. So I lost 40% of my lung function back in 2010.
Hmm.
I had a heart attack and triple bypass in 2018,
Hmm.
and most people don't believe it, but last year I had 2 strokes and 2 surgeries.
Wow.
So I'm pretty blessed. I don't think God's
Yeah.
ready for me. I
Yeah.
think I haven't annoyed enough people yet, but I'm working on it. Okay, do those play a factor in how you treat somebody,
Um,
their
if
history?
if you, yeah, definitely. So I spend a good time getting their history because of that factor, because of all your history. I make sure that, I understand what you've had, your surgeries. There's an intake. It takes about 90 minutes for first time patient.
Is it paperwork? Because that's a pain in the butt for me.
No, we have an
Yeah, I'm
online.
only kidding. So when you say, so I come to you and I say, these are the things that are wrong. This is my past
Hmm.
history, and then you make a protocol of what you're going to do.
Yes, I'll tell you exactly what's going on in your body. I also do an examination. We also take a look at your tongue and your pulse in Chinese medicine.
Okay, I've heard that before.
Hmm.
They can tell a lot by the look of your tongue.
Yes.
Really?
Yes. So your tongue, you can imagine all your organs are in your tongue. Your tongue is the muscle in your body that I actually can visually see. So,
Okay.
the tip of your tongue is your heart. A lot of people have a red tip, and that shows that they've been stressed. The heat is rising into the heart.
Oh, wow.
Then the liver is the sides. Inside the middle is the spleen and stomach. I can see what's going on with your digestion.
Okay,
So,
so I mean, I guess that's some sort of gauge to what you need to do or what you need to work on.
hmm.
Let's get off the acupuncture part and let's talk about the herbal side.
Hmm. So herbal medicine
Hmm.
has been studied also for thousands of years.
Right.
So they know what herb can cool down the body, can remove stagnation, can build blood, tonify the spleen and stomach. So we use it as a combination of a formula, and then we give it to the patient to help with more than one issue.
So my belief is I think you're wasting time if you go to GNC and decide, hey, I'm going to pick one of these, one from column A,
Yeah.
and one from, Am I correct in thinking of it that way?
So my patients are very lucky because I have a lot of education in supplementation.
Right.
So actually, not just Chinese herbs, but I do offer recommendations for supplements. I will tell them what they're deficient in, and we can also run labs to confirm that. But I will give them a list of supplements that they should be having in their diet.
So, correct me if I'm wrong, but if, let's just say vitamin B.
Hmm.
If I get a vitamin B shot, it works much better than taking a vitamin B pill.
Yes, and I use the methylcobalamin, which is already been methylated, so it absorbs immediately into the body. So most doctors are, offering the cyano one, which cannot absorb as well. Which, I'm not sure why they do that because the methylated one has already been can absorb immediately into the body, and it's way better for the patient.
How? Okay. So I come in, I get a vitamin B shot because I'm tired.
Hmm.
How long does it take to work?
Usually in one day.
All right. So is it something that you should go like once a week and get a vitamin B shot? Once
Well,
a
if
day? Once a month?
Well, that's where the labs come in. If you've had your labs done and you saw that you have a deficiency of B vitamin, then we can know exactly how often you can come in. Typically, it would be once a month if it's just trying to stabilize. But if you have a deficiency, then you can come in every week and get that shot.
And taking a shot has no negative effect because I know that taking a if you take a pill, and correct me if I'm wrong,
Hmm.
and let's say it's 1,000 milligrams, but you don't get 1,000 milligrams because a lot
No,
of it,
doesn't get absorbed.
right, doesn't
Yeah,
get absorbed and releases
right,
out of your body.
right.
When you take a shot,
Hmm.
it all gets absorbed,
Yes.
so you don't lose any of it.
Mm-mm. And that
So
a lot of people do have that deficiency of absorption. They don't know how to absorb it. And this is why a lot of us don't feel well.
I think I blame it on old age. Sometimes I blame it on old age. All right, we're getting tough for time. Let me ask you a couple questions.
Okay.
How do people find you?
I am in Port St. Lucie. My address is in Calabria Circle. I'm right on Gatlin near Savona.
Okay.
I have a website, acupunctureherbsolutions.com.
And you have a
And
phone number?
yes, my phone number is 772
Sometimes we don't, because we don't call ourselves.
Yeah.
So it's like we don't really always remember them. So I call you up and I say, hey, you know what? I've not been sleeping well. What's my next step?
So I would have you come in and speak with me. Patients sometimes do want a consult first, but usually after their consult, they get a treatment, and we can discuss why you're not sleeping well. I can take a look at your tongue, your pulse, examine which organs are affected, and work the organ system with the channels of the body, which are connected to the nervous system. So we help with that.
So if there's issues with an organ in your body,
Hmm.
does that affect your sleep?
Sure. So, like when you have high cortisol levels and your liver is stagnation, that's what they call it in Chinese medicine, your liver is active. Um, so, we try to soothe the liver with Chinese herbs and with acupuncture, and then that way you can sleep better. There could be other factors with your heart. So, we look into all of that and get you the perfect formula just for you.
And of course, my last question, which is my favorite question, is I come to you, are you going to change my diet?
Well, yes, I would do that, but that's also depending on the patient and how much they want to be involved with every aspect of their life because, I do the nutrition recommendations, and every patient has a different recommendation depending on their body and whether or not what they can and cannot do. So it's all up to the patient. This is their body, and I do the best that I can to help them, and I will educate my patient as much as possible on what they should avoid and what they should eat. And that's just the way I am as a practitioner.
Well, as long as you don't take away dark chocolate, I'm okay, I guess.
Well, that is a healthy one.
Yeah, it is a healthy one. Doc, I want to thank you for coming on. Everybody, what she does is not a DIY project. You can't go on Google and say, this is what they say vitamins to take. You really need to talk to a professional. And you need to talk to a professional that you can get to more than just once. Because if you look on Google and you'll never get to almost never get to that same page again, and you won't know what to do if something goes wrong. Use a professional. I say it all the time, and especially when it comes to your medical health. With that, Dr. Khalili,
Hmm. Dr. Khalil.
Dr. Khalil is available. Give her a call, touch base with her, have a consultation, see where you need to go to get to the health that you want to get to. With that, everybody, have a great day. We'll be right back.